washing my hands. Hi, my name is Janelle, and I'll be conducting a focus assessment of the head, the face, the neck, and the regional lymphatics. For this assessment, I'll be using Natalie with her permission. Natalie, you can say hi. And I will be explaining as I go along and demonstrate what I'm inspecting and palpating, as this is the proper technique and normal findings of the focus body system. First, I'll be inspecting the overall head for its size and shape and symmetry. A normal head is proportionate and symmetrical. I'm also checking the scalp for any lesions, lumps or scaling. I'm looking for a uniform skin color and no redness or swelling, any abnormal hair deviation. Okay. Next, I'm palpating the scalp symmetrically as I go along. Check for tenderness, any masses or irregularities. Do you have any pain?
No.
Okay. I'm palpating the temporal arteries both sides to check for strength and symmetry. I'm also checking the temporal mandibular joint as the patient opens and closes the mouth to assess for pain, clicking, and limited movement. Normally movement the smooth is pain-free. Did you feel any pain there? Okay. And moving on to the face, I'm inspecting the face for symmetry. Any involuntary movements, and I'm looking at the skin for uniform color and any signs of swelling, drooping, or any abnormal facial expression. The face should be symmetrical with even tone, and expression should be appropriate for any given situation. I'm palpating the facial bones and jaws for any tenderness, swelling, or irregularities. Did you feel pain there?
No.
And normally these areas are non-tender and smooth. If I were to assess the cranial nerve 7, I would ask the patient to smile, to frown, to raise her eyebrows, and puff her cheeks. If I were to know one side drooping, it could be a sign of stroke or just damage to the cranial nerve 7, or maybe even Bell's palsy. But as you could see, there was any of that, so everything normal. It was normal. And then moving on to the neck, I'm observing for any masses, any swelling, checking the trachea. It is midline. There's no deviations. The neck is symmetrical. And then I'm palpating the cervical spine for any tenderness. Do you feel anything there?
No.
Okay, moving to the thyroid glands by locating the isthmus and the lobes. I'm assessing for size, consistency, any nodules or any tenderness, any pain on the thyroid area. Anything there?
No.
Normally the thyroid is smooth, firm, and non-tender. So now I'm gonna assess for neck range of motion. I'm gonna ask the patient, turn her head side to side, ear to shoulder, other side, chin up, chin down to your chest, perfect. I'm gonna assess for cranial nerve 11 for function of motor. I'm gonna ask the patient shrug up. Okay. Place my hand here on the cheek. Can you turn that way? Opposite side, perfect. So now I'm gonna palpate the lymph nodes symmetrically with 3 fingers. At the end of my fingers, I'm gonna do a circular motion. I'm gonna start the periocular, postocular, occipital right on the occipital bone, and then post-cervical right in the back. Perfect. Moving on to submandibular, submental, the superficial, cervical, post-cervical as I go down the neck, deep, cervical. And now I'm going to go into subclavicle. I'm going to ask the patient shrug up. Okay, and I'm checking for each node for size, tenderness, mobility, and consistency. Normally, lymph nodes are not palpable, or might be if they're small, soft, and movable. If I were to feel something enlarged, I would further investigate the size, the consistency, the location, as this could indicate possible infection or any other conditions. And that concludes my focus, head, face, neck, and regional lymphatic assessment. I inspected, I palpated each region, and I assessed the range of motion in the cranial nerve 11. I thank you for watching this, and I thank Natalie for helping me out. Thank you.